Megan. I'm here with Ben, Gianna, and Grace, and we're going to show you our design for a biodegradable scaffold meant for burn wounds that acts as both a dressing and promotes healing. So our product is meant for low resource environments such as low income countries or conflict zones. And just to put this in perspective, in 2023 alone, there was over 180,000 deaths that could be attributed to burn injuries, with a vast majority, up to 95% of these burn injuries occurring in low or middle income countries. Burn injuries are also very prevalent in wars, with 20% of battlefield wounds being burn injuries, and civilians are also highly affected by burn wounds, with up to 16% of civilian injuries being classified as burn wounds. So there's currently no easily deployable treatment options that are suitable for these low resource environments, specifically for second and third degree burn wounds that combines infection control, mechanical strength, and promotes scaffold-driven regeneration.
We want to target the market of specifically low resource communities with a special focus on our soldiers and civilians being harmed during conflict. And specifically, we want to look to appeal to our military services, Red Cross, and other emergency service organizations. So as a result, we wanted to develop a bioresorbable scaffold specifically for second and third degree burns that integrates infection control, mechanical durability, and reduced pain throughout the healing process. So that leads to our design specifications. We were going to use a CMC hydrocolloid microbead layer suspended in a gelatin. This would be very thin. This will be our patient contacting layer. It's meant for antimicrobial properties as well as sticking to the skin. It'll then be topped with a PLGA scaffold, about 1.5 millimeter thickness to compare to our competitors. It'll have an 85% concentration to make sure it's lasting throughout the duration of our healing process, as well as having an incorporated 15 micrograms of hyaluronate epidermal growth factor, as well as some fenestrations, curved and feathered edges to both help stay adhered, and make sure that it is not lifting.
Benefits of our approach is primarily in the pain management during the duration of the wound healing. So with our one applied device, it's going to have 100% pain reduction with requiring no dressing changes, compared to some of our competitors that require up to daily dressing changes, which causes a pain spike of about 40% with the patient. The thin material of our design does allow for flexible conformation around the complete wound site, with a minimum of 1 unit used, but we can layer multiple units depending on the size of the burn. Also, second and third degree burns have a longer duration of healing, so our scaffold persistence will last up to that 3 to 6 month time period before resorption into the body, all while not requiring a secondary wound site for grafting. The cost breakdown is to your right, with each item, the bulk unit cost, the amount used per unit, with the total cost per unit being a little less than $500 for a 10 centimeter by 15 centimeter design. This compared to the average medical cost per patient between $1,500 to up to $18,000 USD, with a 47 plus length of hospital stay. Our design is very competitive and advantageous for burn wound victims.
Treatment options for burn wounds include both short-term dressings, which act as wound coverings, or long-term grafts, which act as scaffolds for tissue ingrowth. Regarding dressing specifically for combat zones and low resource environments, tilapia skin or transforming powder dressing are the two most prevalent options. However, the depth of the burn can greatly reduce the efficacy of the dressing, as deeper burns are treated less effectively with these dressings. And also in the case of transforming powder dressing, the dressing material is non-breathable after drying. Regarding grafts and scaffolds, skin autografts and allografts are the gold standard for burn wound treatment. However, autografts induce secondary wound sites, which increase the potential for infection and prolong healthcare stays, while allografts require intensive treatment prior to grafting, which is not applicable for low resource environments. Alternative graft options include a list of bioresorbable hydrogel matrices, which are often required to be applied in a controlled clinical setting and require extensive surgical wound prep prior to application. They can also incur low rigidity, which will increase the risk of separation from the wound bed during healing and reduce the wound generation.